Good morning, good afternoon, good evening, wherever you are in the world. My name is Ethel Richards, and I am the plant-based nutritionista here to inspire you to take your health back one meal at a time by eating more plants. My personal mission is to live and teach others a life that honors the health and well-being of our bodies, our minds, and our emotions, emphasizing holistic nutritional health and wellness in tandem with social, financial, spiritual, occupational, environmental, and physical health and wellness. And while there is a reason, there's always a reason, there is no reason that we should be
Mhm.
suffering and dying from preventable diseases. Your life and your lifestyle matters. I believe that our current state of health and quality of life collectively is far below what it can be, and it does not have to be this way. Our national and global health and wellness data convey that many of us lead a poor quality of life, die too early, and have normalized feeling less than our best selves all too often. And at the same time, I know from the various community conversations that I have led at all levels across many arenas that most people wish they knew what they could do to reclaim their overall health and wellness and even sustain it. I believe that we can both enjoy our food-based cultural norms and traditions that we love and enjoy so much, improve our understanding of and our relationship with food, and do it in a way that gives our bodies life, helps us to thrive, live our best lives, and add value to our well-being and quality of life rather than subtract from it. And I believe we can do it in just two words: lifestyle changes. Yes, we can change the narrative surrounding normalized, acceptable diseases or acceptable conditions just because it may be all we have seen, heard, and or know. Well, today we are going to focus on changing the narrative as it relates to preventing stroke and improving our health outcomes if we have had one. So December's in the kitchen with the plant-based nutritionista focuses on our health and safety as we get into the thick of the holiday eating season, specifically the signs and symptoms of stroke, as we gather more with our friends and family. Today, Dr. Paul King joins me in the kitchen to kick off my podcast, where we will both educate and inspire you to take your health back one meal at a time by eating more plants. Dr. Paul King is a board certified neurosurgeon who recently practiced general neurosurgery in Atlanta, Georgia. Dr. King was born and raised in Grand Rapids, Michigan. Prior to coming to Atlanta, he was in academic practice in Detroit, Michigan with University Neurosurgical Associates PC. He served as chief of the Department of Neurosurgery at Grace Hospital in Detroit and as the co-director of Detroit Receiving Hospital Spinal Cord Unit. During this time, he treated patients at several Detroit area hospitals. He also was an assistant professor in the Department of Neurosurgery at Wayne State University School of Medicine. Dr. King received his undergraduate degree in chemistry from Fisk University in Nashville, Tennessee, and minored in chemical engineering at Vanderbilt University while at Fisk. Wow, that's awesome, Dr. King. He earned his medical degree from Michigan State University College of Human Medicine, where he served on the board of directors for the College of Human Medicine Alumni Association. He completed his internship in general surgery and residency in neurosurgery at the Henry Ford Hospital in Detroit. Dr. King completed a neurosurgery spine fellowship at Emory University, and he has presented many lectures, abstracts, papers, and presentations throughout his career. He has been the director of Making Sense of Spinal Instrumentation, which is a bioskills lecture and laboratory seminar for nurses and other healthcare personnel. In 1999, Dr. King founded the Metro Atlanta Neurosurgery Foundation, which has a program called Adopt a Village, whose mission is to provide medical services, medical resources, and essential medicines to people living in rural communities in developing nations. To date, Dr. King, along with the Core Labu Neuroscience Foundation, has led several medical missions to West Africa, specifically Ghana, Liberia, and Nigeria, and they have shipped equipment, medication, and supplies to West Africa. Dr. King continues to travel to Nigeria, Liberia, and Ghana to perform several complex surgeries and to mentor young African neurosurgeons, nurses, and surgical techs. Dr. King has served as president and the chairman of the board of directors of the Atlanta Medical Association and on the board of directors for the Medical Association of Atlanta. He is a member of numerous professional organizations, including the Georgia Neurosurgical Association, the Medical Association of Atlanta, the American Medical Association, the American Association of Neurological Surgeons, the Congress of Neurological Surgery, the National Medical Association, and the Medical Association of Georgia. He also has served on the editorial board of Clinical Neurosurgery. Dr. King's specialties include general neurosurgery, reconstructive spine surgery, cerebrovascular surgery, microsurgery, peripheral nerve surgery. Dr. King recently retired, and I'm so grateful that he has graced us with his time and presence today. Dr. King, welcome to my podcast, In the Kitchen with the Plant-Based Nutritionista. I am honored to not only have you here, but also to have you as my very first guest.
Thank you very much. I really appreciate the invitation, and I really appreciate you calling on me. I really have followed your career, and I'm proud of you. I think that you've done a lot, and I'm sure that you're passing that forward on to other people.
Thank you so much, Dr. King. I really appreciate that. And you have been very supportive of me by way of my aunt, who is my namesake. And you've been very supportive of me. You've answered the calls all times, I would say day, when I had questions during my studies. So I really appreciate that. And I do not take your partnership and your support of me for granted. So thank you very much.
You're very welcome. I'm just very proud. One thing I want to really let people know, and that is service is the rent that we pay to God for living on this earth and breathing his air. And so service to others is what we're about. And I think that, talking about these kind of things in a population of people who have high incidence of diabetes, cerebrovascular disease, cardiovascular disease, and have high incidence of strokes is very important. And it's one way of giving back. It's not giving back to the community. We shouldn't just take from the community, we should give back. That's one thing I really want to say.
Absolutely. And you hit the nail on the head. I love that saying about service is our rent that we pay to our society and that we should be giving back. And, Dr. King, I think the world would be a better place if more people really live that out. We would see how much more we have in common rather than focusing on all of our differences. But I think our differences is what make us better. It makes us unique. It keeps life interesting. So I long for the day, and I'm crazy enough to believe that one day we can all get along and work for the well-being of one another. So what I'd like us to do is envision our time together today, just sitting around my kitchen table as we discuss the importance of the heart-brain connection, specifically as it relates to stroke health. And I want to again say welcome, Dr. King, and thank you for joining me in the kitchen. So first of all, you are a recently retired neurosurgeon. First of all, thank you for your service to the medical community, not only in the greater Atlanta metro area, but also in the Detroit area, as well as in West Africa. Tell us what that transition has been like from, the day-to-day grind of being a neurosurgeon to transitioning into this next phase of your life. What are you doing these days?
Well, what I'm doing these days, well, first, the transition it's been good, and it had some difficult times. When you're on top, I always think you're the man and doing a lot of heroic things on a daily basis, and then you stop doing those things. There's a lag period in your life, and it's tough just to get through that. But once you do and focus on some things, I think that it's very rewarding. And you look back on your career being very rewarding, and I would do it again. And what I'm doing right now, though, is I am involved in it's also plant-based. I'm involved in a cannabis testing lab opportunity. And we're starting a testing lab for cannabis products. And it's another thing of giving back to the community, because there's a lot of contaminants and there's chemicals, there's microbes, there's a lot of things that are in the plant that are foreign, that need to really be tested for, and to keep the public safe. And so we're developing a cannabis lab, and it's a scientific endeavor. It's analytical chemical analysis on the plant, both marijuana and hemp, both types of cannabis. And there's some research that we're trying to start. Tomorrow I'm starting on learning how to do tissue culture on growing cannabis plants in the laboratory, and by tissue culture, which is a new technique. Or it's not a new technique. It's been around for tomatoes and different vegetables and things to help them stave off viruses, and other microbes. And so that's something I'm starting on tomorrow, a little project, so I can learn that area of science in cannabis.
That's awesome, Dr. King. And I've been hearing a lot about this market and how people are leveraging it to help people with various comorbidities live a better quality of life. And so I know that hemp and marijuana has gotten a bad rap with the abuse of it, but you could say that about any herb. If you will.
Can say that about anything we do. We abuse
exactly.
Pork. We abuse pork. We really abuse chicken. But we got on this journey because we are learning some of the medical things about cannabis. My wife was having cancer, and she had a lot of pain. She had no appetite, and she started trying this, and it helped her mood, it helped her appetite, and it helped her pain. And I think that she survived longer having that. And I found that with many people. And there's many people who gotten on this journey just for that reason. They had family members with cancer, family members with strokes, and they gave them non-euphoria doses of cannabis, and it helped their problems, and it helped with cancer.
That's beautiful. That's good. So Dr. King, that's amazing. I wish you all the best. Of course, if I can support you from a research standpoint, please let me know. I'd be more than happy to support you in that endeavor as well. So tell us, I don't want to take for granted, what is a neurosurgeon? Tell us what that is.
Neurosurgery is a specialty in medicine and surgery where you evaluate and treat neurologic conditions. And we evaluate and treat specifically neurological conditions that would be amenable to surgery. But there's a lot of people we see that don't have diseases that are amenable to surgery, or don't even need surgery. And so we evaluate them too. But we operate on different parts of the nervous system. The nervous system being the brain, the spinal cord, and the nerves that come out of the spinal cord, and like sciatic nerve, and like what we call ulnar nerves in the arm and hands. And so we treat brain tumors. We treat arteries that are bad, like aneurysms that rupture. We treat patients who have cerebral hemorrhages and other types of diseases in the brain. My specialty, really at the end of my career, was trauma. And so we treat people with all types of cerebral spinal trauma, and the spinal cord trauma, nerve trauma, and brain trauma. And I was basically a brain trauma expert. Like my thing was gunshots. So gunshots to the head. And that's another way of giving back to your community. Whether or not we want to admit it, but we live in a knife and gun club community if you live anywhere in the inner city, and big cities especially. Like I've lived in Detroit and Atlanta, and those are big knife and gun club cities, so to speak. And so I learned that it was just one of those things I learned because I was exposed to it more than I would have been living in suburbia. and practicing in suburbia. And so I just credit myself as somebody. If you get shot in the head or your family member shot in the head, you know, if I'm around, they usually would survive. You know, a lot of people just blow them off. You know, it's another Black person, you know, getting shot. But we spent a lot of time and really made that our mission is to make people survive these types of things.
And that's beautiful to hear, because not every gunshot victim was intended. You know, some people are innocent bystanders or sleeping in their bed, and the bullet comes through their wall, and you know, they're, you know, like I think that recently happened a few months ago with a pastor's wife, but you know, she's in her bed sleep, and he hears her breathing, you know, in distress, and somehow a bullet has come through the wall right into her head. So thank you again for your service. I don't think people really see it that way all the time, but you know, it's physicians like you that I think help restore confidence in the medical system as a person of color, to know that when I walk into a place in need, that I'm vulnerable, but that you're looking at me as you are somebody's child, you are somebody's relative, and you deserve to live. I'm going to do whatever I can to support you in that. So thank you again for that. It's remarkable. And again, I just wish every physician had that same spirit. And I'm crazy enough to believe that, you know, through the work of people like me and yourself, just out there talking and having these conversations, that we will help begin to change that narrative. And so I know we want to talk about stroke today, but I think whether we talk about stroke or even we talk about the recovery aspect of having a brain injury, I want to lean into that just a little bit today. So tell us, well, I guess we'll do it this way. Tell us what is a stroke and how does that even happen? Can you give us a little bit of the science behind that?
Sure. I look at a stroke as being a brain injury or some sort of process that injured the brain. And that process comes from lack of blood flow to certain areas of the brain. And if you have no blood flow, just like you have no water to water your grass is gonna, you know, die. You know, especially when in hot climates. And so if you don't have blood flow to parts of your brain, those parts of your brain die. And those are called strokes. In the heart, it's called a heart attack, you know. And there's various variations of the theme. You know, you can have a small stroke, or you can have a transient attack that is a mini stroke, but it hasn't really become a completed stroke because the blood flow stopped for a small amount of time, and then it started again, and the tissue there did not die. And so once the tissue dies, then it's basically called a stroke. There's there's types of strokes that are both non-hemorrhagic and hemorrhagic strokes, and that means either strokes with no blood there, no blood clot, and there's strokes that have large blood clots, and there's different mechanisms for those things to occur. But if you basically have had a stroke and then the blood starts flowing again and the stroke is large enough, then that brain tissue cannot handle having blood coming back in there again. So again, if you have a water hose and you water dead grass, you just get mud. And if you have a brain that's had tissue that has died, and then you try to put blood flow back there again, then you have mud, and that mud is not mud, but it's blood. So I don't know if that makes sense or not, but that's how I look at it. And I like to keep things pretty simple because I'm just a simple person.
Well, we appreciate that, and I'm sure our listeners do as well. Thank you for that. I think that helps people get a nice visual of something that's very complex, to help them understand what a stroke is and the difference between the hemorrhaging versus the not. So let's do this. So I'm listening to all this, let's say I'm an average listener, how do I even get to the point where I'm at risk for having a stroke? How does somebody get to that point?
Well, the general risk factors like high blood pressure, diabetes, obesity, cigarette smoking and taking birth control pills, especially birth control pills, while being a cigarette smoker. That's in women. That's a really high risk for strokes. But basically, people who have high cholesterols, and there's some people who have high cholesterol because they take in cholesterol in their diet, and there's those who just have high cholesterol because they have congenital or a genetic cause for them to have it. So maybe a whole family of them may have had it, or a lot of people in their families may have had high cholesterol problems or high triglyceride problems.
That's really helpful to know, and how we get there. And we're going to spend a little bit of time talking about more of what even leads to that. But just curious, so we have an idea of what a stroke is. We have an idea of how somebody even gets to that point. You're saying high blood pressure, high cholesterol. I think I heard you say smoking, birth control while smoking, even diabetes, all contribute to this thing called stroke, where blood flow is not, traveling through our brain like it should be. We are all going to be sitting down and eating again closer to Christmas or throughout the Jewish holiday or Kwanzaa, depending on what one observed, or even if it's just a regular Sunday family dinner. What are some things that we should be looking for in our relatives as we're gathering around the table or at each other's houses to keep each other safe? What should I be looking for in terms of signs and symptoms of a stroke?
Well, some of the most common, or the thing that you see the most often, are people have some weakness or numbness on one side of their body, maybe in their arm or their hand, or their leg, or their hand may just get clumsy, and very weak. Sometimes people have a headache associated with that. There's some classic signs of like a impairment of your vision, and like a window shade had come down over your vision, and maybe then it had gone back up. That's a sign of a pre-stroke or a transient ischemic attack.
That's really helpful.
Oh yeah, and drooping of the face. And if your family a member, you're sitting at the table, and you look at them and you notice that their face is drooping, and they may be a little bit weak. They might even be a little bit have difficulty with their speaking. That's something that should be taken. That person should be taken to the emergency room and evaluated right away. It's like people who have heart attacks, they have chest pain, can't breathe. You gotta get on that pretty fast, because what we say is time is brain, meaning that if you don't, if you take too much time, you're gonna kill that part of the brain. So you need to get there, get treated immediately.
That's really helpful. Time is brain. We always hear time is money, but time is brain. Time is your life.
Can't make money if your brain's not working.
That's right. That is so true. Now, can we dispel any particular misunderstanding? Does a stroke discriminate on what side of the face starts to droop, or can it be any side of the face? Can it be any hand that gets limp or droopy, or is it only one side of the body?
Well, in general, and the most common things are that the stroke will occur on the opposite side where the face is drooping, or on the opposite side where the arm is weak. Okay, and that's the side the stroke will be on. So you have the symptoms, and say, for example, you have somebody who is talking and then they can't get the words out at all. And then that's usually a stroke on the left side of the brain in most people, because most people are right side dominant. Left side dominant. And when you're left side dominant, the speech centers are on the left side of the brain. And so if you have a stroke on the left side of the brain, you just start talking and then you can't get those words out. And it's like you know what to say, but they just won't come out. and then your right arm gets a little weak, or your right leg gets a little weak. You might get up from the table and then stumble and crumble because your leg was weak, you know. And so there's only small instances where the same side of the brain that has a stroke is weak, but that's like 1% of all strokes.
Okay, thank you for that. That's really helpful to know that we're looking for opposite if someone is stroking, and we can communicate that back to, the paramedics or the whatever clinical team is supporting the care of our loved ones. So speaking more about stroke, before we get into prevention, can you tell us a little bit about the age demographic, or at least of the patients that you have treated over the years? Were we talking middle-aged people or much older people, or have you seen a range of individuals coming into your care that have suffered from stroke?
Well, there's always a range, and you think of different causes for stroke at different ages. But in general, the hypertensive, hypercholesterol, diabetic is usually who has a stroke is usually in the age of over 35, over 40, 45, 50, and then even upper age, in very elderly, they have different causes for stroke. But it's usually, I'd say, 45 to 65.
Wow. So what I hear you saying, you've thrown out these we call them comorbidities a couple of times. You said hypertension, you said hypercholesterolemia, you said diabetes, and of course other lifestyle factors like smoking and age. It sounds like these things are all preventable. Is stroke something that we can really prevent if we really wanted to, barring nothing genetic at play?
Right, I think we can. And how we do that is through behavioral change. Behavioral change, and that is, eating correctly, taking care of one's health correctly, even monitoring your blood pressure periodically. And, going to the doctor, having the doctor, check you out both, physical exam wise and, testing some of the blood, things in the blood like cholesterol, and maintaining a healthy lifestyle, like exercise, like, not, like being relaxed, and maybe meditation or exercise that provides some type of relaxation.
Yeah, thank you for that. I think you've just spoken truth to power. And these are things I think, Dr. King, we hear for a lot of conditions. We hear the same thing, I think, for heart disease. I know for heart disease, for some cancers, and I know I want to be very careful with that. That's a very touchy topic, but diabetes, type 2 diabetes, and other diseases, it goes back to, I think, I want to say the sandbox, where we say healthy eating. We talk about eating fruits and vegetables, but yet we live in a culture, I would say it's pretty food toxic. There's a lot of confusing information out there about what really is healthy, and just, looking at just the history of how food has evolved, if you will, from cooking at home and eating off the land to now relying on industries to prepare prepackaged things for us. What would you tell someone who is saying, I really want to take my health back? I don't know where to start. What would you say to them to say, hey, your health matters, just put a stake in the ground? How do you talk to your patients about that?
Well, I think if somebody wants to do that, I think they need to go to a wellness type physician. And they have a lot of people that are specialized in wellness, but I think there's physicians that specialize in wellness too. And I would think they're mostly family practitioners or internal medicine doctors who really have a dedication to practicing wellness type medicine. And so those doctors would evaluate you, get you into some type of program. I think it's a behavioral change, and so you need behavioral type programs. And also, I think they're in consultation with a dietitian, so a dietitian can help you select the right foods to eat for you, not necessarily for somebody else, but you may have a special type of situation if you're, hypercholesterol. So you need a diet that's low in triglycerides and low in cholesterol, and talk to people on a continuing basis with follow up, because we may go once, but it's probably best to follow up and really go multiple occasions.
I'm so glad you said that. As you know, I'm a plant-based nutritionist, Dr. King, and I am always, I would say, preaching to as many people that will listen to me about the importance of eating more plants and loading your plate with plants. That's actually the holiday challenge we have going on right now throughout this eating season, just to load your plate with plants. Some people are really determined that they're never going to stop eating different types of animals, and I am okay with that. I just encourage people to consume those animals as condiments on your plate so that you can thrive, especially if you have conditions such as high blood pressure, high cholesterol, diabetes. And we just sat here and learned from you about how those things actually contribute to stroke. And to me, it just seems like, why pay $500,000 in case management because I have a condition that I can prevent when I can just eat more plants and save that money? And not only in case management, long term, but co-pays at the doctor's office, gas to the doctor, time off work, quality of life. There's so many things that suffer. So I think we're on the same page where we're saying, like, hey, we all know the answer, but we just need that community around us to help support that healthy lifestyle. And I think you hit the nail on the head when you said behavioral changes, which is something that I focus on.
Absolutely.
We say lifestyle change in our work, but that's what it is. You're changing your behavior. We're changing your relationship with food, which for some people, they'll tell you, well, I just do what my mom did or what I saw grandmama do in the kitchen. And I would say that the food was much different then than what it is now. We don't love our planet. We don't love our animals like we used to. And we also didn't go out and do a lot of manual labor after eating some of those foods. So the narrative has changed a little bit in how we can live our lives. So I'm excited to have you here. I have a few more questions before we wrap up. And I think we already touched on it today, but to our listeners that may have had loved ones come to mind or maybe even saw themselves in our conversation, what practical advice can you offer them to draw a line in the sand to just prevent and possibly even reduce any of their risk factors for stroke? And we said those risk factors were high blood pressure, cholesterol, diabetes, also known as sugar in the Black community, smoking, drinking, things like that. What practical advice can you give somebody who's saying, I'm on the fence, I just need to hear something to encourage me to say, this is my time?
Well, one of the biggest things I think is, don't listen to that thing in your head that says, I want to have another bite. I want to do seconds, especially during the Christmas and Thanksgiving season. That's the first thing. I found this in myself. I don't usually do seconds. I don't usually go up again and again and again and stuff myself like I did in the past. And so I think that's one of the first things. And it always comes to eating. I don't necessarily eat all plant-based stuff, but I do eat a lot of plant-based things, especially since the things have been made to taste like we want them to taste. We didn't get this way in a day. People taught us how to taste, and McDonald's taught us how to crave that McDonald's burger and how to crave beef. But I say we can get along with just plant-based, because look at cows, look at apes. Apes don't even eat meat. I mean, only if they have to. And they're the strongest, and they're very docile, not docile, but they're not like the lion who kills for blood, basically, for meat. But they're not. They eat, plant-based, and they're strong, and they live a little while too. So I think that we have to go back and look at where we came from. We came from this idea of McDonald's is so good, but what we did was we got McDonald's rich, and we started having strokes. So that's one of the things that's the way I look at things. That's pretty simple. And we have to, now that we crave this beef, now we crave this chicken, then we have to see how we do it in moderation, since we can't stop the craving. And doing it in moderation, to me, anything that's good for you, you want to keep doing it. But in moderation is best. And so, do what you can do to be satisfied and maintain your health, maintain so you're not malnourished. And then I would say try to just maintain that. And that's a hard behavioral change, because you see this chocolate pie, or this pecan pie, or a peach cobbler, and you just got to have it. And it was so good, I had to go get some more. No, you have to do things in moderation.
There it is. You have spoken truth to power. Dr. King, thank you so much again for being on our podcast, In the Kitchen with the Plant-Based Nutritionista. I would encourage everyone to join Team I Eat More Plants and partner with your doctor as you embrace a personalized lifestyle of physical activity and whole plant food eating, so that they can monitor and adjust your medications if you're on them based on your positive lifestyle changes. You can do it. We know you can. Thanks again for listening in. Dr. King, thank you so much.
Hey, you're welcome. Thank you. That was very good, very interesting.